Hey guys, so I am here with Dr. Adam Rubinstein.
Hey guys.
He is all the way here from Miami, and he calls it the Wild West of plastic surgery because, as you know, they're connected. They're very international there in Miami, and so he has agreed to join us. That if you at any point in your life are looking at getting some type of cosmetic procedure, what you need to look for to get a really great doctor. He's got 3 tips he's going to give us, and he's also going to share some horror stories because I feel like that's what gets people's attention. So thanks for coming in.
Oh, thanks for having me.
So let's start with some of the procedures that you typically see being the most botched. What are people coming into you to get fixed?
Well, we see pretty much everything across the board, but we do see a lot of lipo, a lot of body contouring, and that seems to be one of the ones that we see a lot because people, especially with lipo, they don't think it's real surgery. So, oh, it's just lipo. It's like, I'm going to go get my hair colored. I'm going to get some lipo.
But I mean, in order to get liposuction, though, someone is sticking a needle. It's not necessarily a needle, I guess, but it's a pointy object into your skin. So to me, I mean, that seems like surgery to me.
It's real surgery. I mean, we're making incisions, we're putting instruments into the body, and we're removing stuff from your body. I mean, people, I think you and I spoke about this on the phone before we did the segment. People spend more time worrying about who's going to do their hair than who's going to do their lipo or even cosmetic surgery. It really should be respected a whole lot more than it is sometimes.
Right. And so I've wrote them down because I want to be concise for you guys because I want to be conscious of your time. Of the 3 things that you need to be on the lookout for when you're aiming to find a good doctor that's not going to give you more than likely a botched surgery. And the first tip that you say is make sure they are certified by the American Board of Plastic Surgery. Why is that important?
Well, it's very important. There's only one board that certifies plastic surgeons in the United States that's actually regulated and a part of all the other boards that you hear about.
Okay.
American Board of this, American Board of that, and that's the American Board of Plastic Surgery. The important thing, there's no board of cosmetic surgery. So if you hear someone say, oh yeah, I'm board certified in cosmetic surgery, that doesn't exist.
Okay. And something that you tell me that is very common is you might go to your general practitioner, you might go to your gynecologist, even your dentist, and they say, I can do Botox or I can do the liposuction. And you look at that person, you think, well, they are a doctor, so they must know what they're doing, but that's not always the case.
Well, yeah, it's sort of like going to an Italian restaurant and asking for some egg foo young.
Okay.
You're probably not going to get the best egg foo young, just like you wouldn't order chicken parmesan in a Chinese restaurant. And so when you go to a doctor that specializes in something, then you're going to an expert, you're going to have good care. But if you go to a place that dabbles or has some idea of what's going on, probably not setting yourself up for the best results.
Okay. And I want to check in with you guys, because if you guys have any questions, the doctor is here to answer those questions, and I want to make sure that you guys can hear us as well. So I'm going to boost my volume a little bit. There we go. Okay. So again, if you guys have any questions for Dr. Rubinstein, he is here to answer those questions as well. But we're going to continue. I'll go through your comments in just a moment. We're going to continue with tip number 2 and tip number 3 to get the best results. So number 2 is make sure that the surgery is being done in an accredited facility. How do we know this?
First thing to do is just ask, because all these facilities should be accredited, and there's only a few accrediting bodies out there.
Okay.
The Quad A, the AAA, the JACO, which certifies hospitals. So you ask, is your facility accredited and by whom? And you can look it up and you'll get the best information. That's a place to start.
Okay, and the reason that you say that is because you have had patients who come in, or maybe not come in from these facilities, but you're aware of facilities the patients might go to where they are pumping out like 100 plastic surgeries or more a day, and that is their goal, to get as many as they possibly can in an environment that might not be safe.
Well, I think when you place a premium on speed, then you're taking away the idea of quality.
Obviously,
because, you can't work fast and great in most cases. So when you're putting time as the priority and not the results, you're going to have problems.
And that would not be an accredited facility.
Well, it could be in an accredited facility.
Okay.
One thing doesn't have that much to do with the other, but I think if you're going to a board-certified plastic surgeon's practice in an accredited facility, you're not likely going to see someone who's doing 8, 9, 10 procedures in a day.
Okay, okay. And that might be another good question to ask is how many procedures do you do in a day?
Well, me personally, I have more of a boutique practice. I like to know that I'm giving 100% of my attention to every patient. You know, I don't want to be doing your liposuction, not that you need any liposuction.
Thank you.
But
just your in general.
I wouldn't want to be doing someone's liposuction and then looking at the clock and saying, oh, I've got Mrs. Johnson waiting for her breast augmentation. I better hurry up. That's not the way I like to work. I really would do 2, max 3 procedures in a day because I want to make sure I'm giving 110% of my attention each time. I think it's not unreasonable to do maybe 2, 3, even 4 shorter procedures if you're working efficiently, but these places are cranking things out, and the doctors are incentivized to do it quickly because they get paid more the more cases they do.
That is just sick. I mean, you'd have no respect for human life, I think, if you were...
Well, I think the scary thing really, I guess patients don't know in all cases, but sometimes patients don't respect their own life enough. You know, really do their homework and look this stuff up and check out where you're going to have this stuff done, because it's easy to get fooled. It's easy to not know that you're in a safe place, and not to know the right questions to ask. That's why it's so important what you're doing today and getting this information out there.
Thank you. Okay, so we're going to get to the next step, and then Dr. Rubinstein is developing something that's going to help you find a doctor that's right for you. So the final step then is make sure that the surgeon has specific separate credentialing at a hospital. Why is that important?
Well, when a doctor applies to do something in a hospital, the hospital really scrutinizes their training, and someone who's not appropriately trained is not going to get privileges in the hospital. Really, only board certified or board eligible plastic surgeons are going to get privileges to do plastic surgery in a hospital. So if you're going to see someone and you ask them, well, you know, I kind of feel more comfortable in a hospital. Can I do this? Can you take me to a hospital to do this operation? And they say, no, you know, all the patients like the office. We don't really do this stuff in a hospital. That's a big red flag, because if they can't take you to a hospital to do it, that means maybe they're not really properly trained, because the hospital will make sure anyone that can do it in a hospital is properly trained.
Oh, okay. Good to know. And then, so let me go over those steps one more time in case you're just joining us. Just very quickly, 3 steps to making sure that you are going to get a safe procedure if this is something that you want to do down the road. Make sure that it's being done by a doctor who is certified by the American Board of Plastic Surgery. Ensure that the surgery is being done in an accredited facility. And then finally, make sure the surgeon has specific separate credentialing at a hospital, that you could actually get the surgery done at a hospital if that's something that you choose to do. And then finally, Dr. Rubinstein, you are developing a database because you're so passionate about helping people, and you will help direct them to a doctor no matter where they are in the United States.
That's right. You know, we're working on a database that you can go to, enter your doctor's name, where he or she practices, and that will give you a report telling you, is a doctor board certified? What are they board certified in? Because it might not be plastic surgery. It's not enough to say, are you board certified? You know, have they ever been sued? Have they ever been disciplined by a state medical board? And so you get all that in a free report. We're not charging anything for it. This is a service for the public.
And you're in the process of building that database. So in the meantime, where can people go?
Great. Well, if you come to Instagram at Plastic Surgery Truths or at Dr. Rubinstein, we'll be announcing it when we launch. That's at Dr. Rubinstein and at Plastic Surgery Truths. Where there's also lots of good information, so you can enjoy that too.
Yeah, you've put together some really nice videos explaining certain procedures that people might be interested in. So if you know, maybe you're tooling around online, or you have a friend that says, you know, maybe you should look into this procedure, you can actually go on to Real Plastic Surgery Truths. Plastic Surgery Truths, excuse me, and you can see perhaps a video on that procedure. So I'm going to check and see if you guys have any questions. Let's see here. Do your homework, John says. Yes, John, thank you for seconding that. We appreciate it. Let's see. I'm checking to see if you guys have any. Okay, Mike says, does it matter what medication you might be taking, like heart meds, if you get a procedure?
Well, sure. Before you have any operation, and that's another important point, make sure you get a medical clearance. There are a lot of places that are more interested in pushing you in and out, and they might not ask you the right questions, do a full history. A properly trained person is always going to make sure that you're safe. We're going to make sure that you see your doctor, get some blood tests done, EKG, chest x-ray, just like you're having any other operations.
Right.
Make sure you're healthy and ready to have this procedure.
Yeah, because some of them, I mean, these are like long-term recovery periods. You know, it's not just like I'm going to do this and then go to work the next day. And you could get an infection. I mean, there's a lot of risks associated too.
I think it can be done very safely. You can get great results, but you have to be in the right circumstances and in the right hands and be prepared, because if you're not in a good state of health, you're not a candidate for this, and a properly trained doctor is going to know that. Someone who's dabbling, maybe isn't trained in surgery at all, but say, I can make a quick buck if I do a little lipo, if I do some injections. Well, you might end up in a bad place.
Okay. Lynette has a wonderful question. She says, what's the difference between body contouring and liposuction?
Well, not a whole lot.
Okay.
Body contouring, liposculpture, liposuction, these are all buzzwords. They're really more used for marketing.
Okay.
It all kind of comes into one thing. But when you talk about body contouring versus liposuction, body contouring is a bigger term. So it could include things like tummy tucks, a lower body lifts, a posterior body lift, a procedure where we're actually removing skin and not just fat.
Okay.
It's a bigger term.
All right, so I think this is probably, Brian asked this question, it's probably a joke, but it's kind of interesting. Brian says, how much fat can you get rid of at once when you're doing liposuction?
Well, Brian, I saw that comment. 180 pounds of fat is probably not a good idea. This actually it really is a good question.
Okay.
And I appreciate you asking it. People sometimes will look for liposuction as a weight loss treatment, and it's not. You're not actually going to lose a whole lot of weight with liposuction. It's really, truly for contouring bulges in the body. So if there's little areas that bulge with excess fat, you can trim it in, tighten it in, and really improve your overall shape, but you're not going to lose weight from it. In fact, the average liposuction, you might lose 1 or 2 pounds, but in fact, you're going to gain weight first because you're going to retain water, there's inflammation, and so ultimately, maybe you'll lose 1 pound or 2, but you're not really doing it for weight loss, you're doing it to change your shape.
And then that fat doesn't come back, right, when you get the liposuction? Because I know if there, weight loss and things like that, if you do a diet, obviously, you can gain the weight back. Or even I've heard if you have the
Cool sculpting.
Cool sculpting, or if you get the stomach surgery,
a gastric bypass or a sleeve, yeah.
I mean, you can gain the weight back potentially.
Oh, sure, yeah. Well, even with liposuction, you can get it back. There's kind of a misconception that when you get lipo, that it goes to other places. It doesn't actually go to other places, but you're changing the ratio of fat in different parts of your body.
Fat cells, right?
Because you're removing all those fat cells permanently. And in the areas where you've removed them, well, now you've got less fat there. So when you gain and lose weight like your body always does, there's less fat cells there. So proportionately, it looks like it's going to other places. But really what's happening is you're still gaining and losing the same way you always have. You just have less storage houses to put the fat into. So it looks like the places that weren't touched with lipo is where all the fat's going.
Okay, so you got to be aware of that, right? Because that's something. Do you tell your patients that?
Well, I tell my patients, look, this is not a permanent cure. You've got to take care of yourself. You've got to stay in good shape and make sure you're eating properly, exercise. Live a healthy life in the first place. So, that doesn't change once you have liposuction. You really need to take care of yourself. As long as you do, and you have good habits to maintain, you're going to look great.
And then Mike asks, I take heart meds and lung meds. Would that be a surgery option for me? I'm overweight and it's hard for me to exercise.
Well, again, the weight loss, if you're overweight and we're talking about significantly being overweight, then you may have a consultation with someone who does bariatric surgery.
Okay.
A gastric sleeve or a bypass may be a good option for you. But again, you've got to be healthy enough for any surgery. So depending upon your heart conditions, lung conditions, you're going to have to see your doctor, and your doctor's going to have to say that you're healthy enough to have surgery.
Yeah, and I think I want to end on just again stressing the risks of this kind of thing, because people can die from botched plastic surgery, and once you get it done, I feel like from the shows that I've watched, it's hard to really undo it, to go back to how you used to look. If things get really messed up, and it's kind of the sad reality of it.
Depending upon what's been done and how bad the damage is, we can fix quite a lot. And I know when it comes to breast surgery, I feel like we can make almost anything better. But there are other things like bulging fat and bad scars. We can improve them. But once you have a scar, you have a scar forever. And you really want to make sure you take that step forward. You want to be in the best place to do that. And one of the things that we do at Plastic Surgery Truths right now is, if you guys check it out, you can send me a DM in Instagram asking about this doctor or that doctor, or just like we're doing now, send your questions in, and I make videos to answer your questions. But when it comes to doctors, we check them out, and we've got a couple segments up there already called my exposed segments. The exposed segments will look at doctors who I think are really egregious and misleading people, and we'll do a whole series of videos explaining why that is and what is the truth about these doctors. So if you find yourself maybe not sure about someone or something, you can always check us out at Plastic Surgery Truths, and we'll try and help you.
All right, Dr. Rubinstein, thank you so much for your time. We appreciate it, don't we? Yeah, we do.
Well, thanks for having me. It's a lot of fun.
All right, have a safe trip back to Miami.
Thanks.
All right, have a good day, guys.
Take
Bye.
care.
Thanks for your questions.